Funding for This Is Nashville comes from you, our listeners, and Music City Prep Clinic, Nashville-based provider for PrEP, and offering comprehensive sexual health services in an environment designed to be safe, professional, and shame-free. Learn more at musiccityprep.org.
I'm Carell, and this is Nashville. What can we all do to stay healthy? Well, that includes everything from daily habits, which really do add up, to routine checkups that keep us connected to doctors and providers. So today we'll be talking about physical and mental health. And later this hour, heads up to our listeners, we'll be talking about sexual health as well. But the conversation will stay PG, I promise. All right, to start off, we're joined by Dr. Carmen Tuchman, a primary care physician, and Dr. Carlenda Smith, a pediatrician, both of whom practice at Vanderbilt. Dr. Tuchman, Dr. Smith, thank you so much for being here. Welcome to This is Nashville.
Thank you for having us.
Thanks.
Okay, so physicals. We're going to start off with this simple but preventative health annual physicals, this health measure. It's really easy for life to come around and we can get busy and we can forget to schedule them, forget to even just maybe even think about them. People don't think if they need to get them unless they have a pressing medical problem. Let me ask you this, Dr. Tuchman, why are physicals so important?
So physicals are important because we're looking for people who are currently not having symptoms with an aim of prevention and long-term health. And they really encompass a large array of things that we're looking for in adults, including cancer screening and prevention, cardiovascular risk prevention, eating habits, staying healthy, getting good sleep. So it's really a comprehensive look at where someone is.
How honest are your patients with you when it comes to physicals?
I think with me, patients are fairly honest. We try to establish good rapport, and they know that I'm just a person who's in their corner trying to help them be as healthy as possible. So they admit when they have good or bad habits.
Okay. Now, Dr. Smith, as a pediatrician, how are physicals different for kids?
So for children, we see kids up from babies to 18 years of age. So when you are an infant, we see them at birth, 2-week checkups, 2-month checkups, 4 months, 6 months, and so on. And we check their height and their weight similar to adults. But we also check the head circumference up until age 2, because if your head's growing, that means your brain is growing. Mm-hmm. So we check those measurements, and then we start checking blood pressure when they're 3 years of age. We also do a photo screen at 18 months of age to make sure that kids can see as well. So it differs a little bit from adults, but there are definitely similarities.
Okay, so what as patients or parents as patients, what can we do to make sure the most of our physicals, in that time that people do spend with their physicians? So
if you have questions, write them down. And we love questions, but I think if parents have questions, to have them beforehand is helpful. That's the main kind of thing that I think that parents can do beforehand, having questions written down and ready to go. All
right, Dr. Tuchman, I just asked you about the honesty of your patients. Do people really divulge everything? Because sometimes, you may have an ache or pain. I may have an ache that I don't think is necessarily serious. Do you want us to tell you about every little sensation that we're having?
It really just depends on how bothersome it is. If you go running and your calves hurt, okay, that's probably just due to running. But something that's persistent, we want you to bring it up. And that's part of our training, is to sort through what is relevant and needs further investigation, and what we can just say, well, that's part of the normal human experience.
Okay. Let's talk about preventative screenings. Those can look like regular blood work, and then there's also other screenings based on age. I want to start with blood work. Dr. Tuchman, what are you looking for?
We're looking for things that may influence cardiovascular health primarily from a screening standpoint. So things like cholesterol, also blood sugar. There's a lot of patients who have diabetes, and when it's mild, oftentimes it's asymptomatic. So we're looking for things that we can intervene on early so that we prevent poor outcomes long term.
Dr. Smith, for kids, what are you looking for in blood tests?
So for children, we do check a hemoglobin at ages 1 to 2. That's to check for anemia. And then we do blood work once between ages 9 to 11 to check for high cholesterol, like Dr. Tuchman said, for just making sure they have good cardiovascular health. If someone has an elevated body mass index, then we might check an hemoglobin A1C to see if there's diabetes, or liver function tests to see if there's fatty liver disease, things like that.
Have you ever had a panel of blood work come back that truly surprised you?
I once had a patient who I checked his lipid panel, that's cholesterol, cholesterol check, and his triglyceride level was close to like 700, 800, which is extremely high. And he said that he didn't feel well and felt down. And I said, probably because, I said, you're almost a solid, because it was just so many lipids in his body. So we discussed diet, changing his diet and those things. But that was definitely surprising to see like a 15, 16-year-old with levels that high.
Yeah. Dr. Tuchman, you ever been surprised?
At least once a week.
Okay.
And some of it is because patients don't bring up their symptoms. And so we'll see sometimes, severe anemia or something like that. And then upon further questioning, they'll say, well, I have been feeling more tired or short of breath when I've been trying to exercise. And so it's a really useful tool.
So really using those tests along with establishing trust and a good communication in the relationship really helps you discover what your patients are going through.
Yes.
All right. Now, Dr. Smith, with kids, what kind of behavioral screening or testing do you look for as a pediatrician? Let's say if a parent or teacher is kind of concerned that a student might have ADHD or something going on, are you the point person for that concern?
We are the point person for that concern. At all checkups on children ages 12 and up, we actually do a PHQ-9, which screens for depression, and a GAD, which screens for anxiety. So that can also start the conversation if parents are concerned about their child's school performance. But in regards to ADHD, if they have a child who's not doing well and the teachers are brought up they don't pay attention and those things, we're the point person for that conversation to be had. And there are forms that parents fill out and teachers fill out so we can come together to have a conversation about the child's school performance.
Okay. Now, before you were talking about the triglycerides that shocked you in your patients, what are normal triglyceride levels?
So in some kids, if it's fasting versus non-fasting, but in general, less than 200, we like it to be less than 200.
Okay. So he more than tripled that.
Yes.
Ooh.
He went for the gold on that one.
Yes, he did. Yes, he did. Okay. So as we get older, we have to have screenings. I'm thinking about mammograms, prostate exams, colonoscopies, bone density tests. Dr. Tuchman, give us the lowdown on those type of screenings and why they're important.
So when it comes to cancer screening, it is a little bit dependent on sex. So for women, we're doing Pap tests to screen for cervical cancer. That starts uniformly at 21, and the frequency varies a little bit, but it's at least every 3 to 5 years. Mammograms, we've kind of come to a more uniform consensus from our governing guidelines recently that they should begin at age 40. Colon cancer screening has been lowered recently from 50, which was the prior starting time for colon cancer screening, which is usually a colonoscopy, down to 45, due to an increase in colorectal cancer in younger patients. And there's a little bit of debate about prostate cancer screening. And so that's one that really depends on the patient and their family history and preferences, because the guidelines have changed quite a bit over the last 20 years or so.
What were the guidelines 20 years ago, and where do they stand now?
Well, so we used to do a lot of PSA blood tests for men to screen for prostate cancer, which led to a lot of prostate biopsies. And many men did not have prostate cancer, and we're going through these additional, anxiety-producing medical tests that have risks. And then the pendulum kind of swung in the opposite direction, and we stopped doing PSAs around 2012. And then we had more men show up with late-stage prostate cancer.
Okay.
So there's various different guidelines depending on who you talk to in terms of the United States Preventative Task Force or the American Urological Association. So I kind of go through the differences like that with my patient and talk to them about their family history, and then we kind of come to a consensus on screening.
What is a good age for a man to start considering or going for prostate screenings?
Well, I would talk with your doctor in your 40s.
Okay.
Yeah.
All right. Now, I want to talk about vaccines a little bit. It's a good time to get them. You're already at the doctor's office. But as we've seen over the past 4 years, people have different opinions about vaccines. What would you both say about vaccines and, to talk to people about the importance of them?
So I kind of tried, then this actually happened, I had this conversation this week with a mom who was vaccine hesitant. But I tell them that just as our digital devices need upgrades and need upgrades, that's kind of how our immune system is. So think about immunizations or vaccines as updating or rebooting our immune system. So when our immune system sees viruses, it can recognize it and detect it and fight against it. So I'm trying to use that analogy more with patients because I think that's more relatable.
Mm-hmm. Dr. Tuchman?
Vaccines are a little bit different for adults, but I think, that visit when we have your physical is a good time for us to go through the risks and benefits. In particular, each patient, particularly as they age, they may have an increased risk for certain diseases, and the vaccine may be more relevant for them. And I may voice that I feel more strongly about it in some people than in others.
Now, I want to switch gears so we can take ourselves a little bit outside of the doctor's office for now. There's simple things that we can do to be healthy, like sleep, exercise, eating, moving our bodies. I want to start with sleep. What helps us all to get a good night's sleep? Dr. Smith?
I think getting off our devices at least 2 hours before bedtime. I see so many teens and preteens that are not getting enough sleep. They're up on their phones, just scrolling, just aimlessly all night long. And our body needs sleep to fight infection, to reboot itself. So just encouraging people to get off their devices at least 2 hours before their bedtime. I have a toddler, and if there's one thing I've learned from having a toddler is just how much sleep they need and they crave. Mm-hmm. And I think it's my responsibility as a parent to make sure she gets adequate amount of sleep. So I just tell parents that sleep is important for every phase of life. And if we can get off our devices at least 2 hours before bedtime, breathe, read books before bedtime to kind of calm them down, and have a bedtime routine. Mm-hmm. When you have a bedtime routine, then children and adults, that's a signal to our brain to calm down and relax so we can sleep.
I'm kind of surprised that teenagers are having a tough time getting asleep. When I was a teenager, I couldn't wait to get to bed.
And I think it's because we didn't have devices like that. Mm-hmm. I was that kid who was knocked out at like 9 p.m.
Yeah. But
I have a lot of kiddos who are up until 1 a.m. just scrolling on their phones, and then parents don't understand why they're not doing well in school, and it's because they aren't getting enough rest.
Okay. All right. Now, Dr. Tuchman, adults, what's a good sleep routine for us?
Similar thing, but I would add in that exercise during the day will often help with sleep as well. Not right before you are going to try to go to sleep, but kind of physically tiring your body out really helps with good sleep quality. And I will mention that sleep apnea is a common condition that we see in adults that has big cardiovascular implications. So if you have concerns about your sleep, please bring it up with your doctor. We want to talk to you and screen out people who have sleep apnea and get them evaluated further.
How important is rest and relaxation? Listeners would know I spent the month of April away on vacation and sabbatical. During that time, and since I've been back, I've been sleeping like a baby. This is the best sleep I've received in 8 years. How much is that an indicator to how we're sleeping and how we go about life? I mean, how important is just taking time off from the daily grind?
So important. I'm envious of your month-long sabbatical.
Thank you.
But I know when it's time for me to have a break when I'm not sleeping well, and it's because I've gone hard for too long and it's time to rest. And I think same with my toddler, that right before bed, she just really, the energy just comes out and she's running around the house, and then she just eventually as we do our bedtime routine, just kind of passes out. So I agree. Sometimes our body reminds us that it's time to rest.
Mm-hmm. All right. If you're just tuning in, this is Nashville, and I'm your host, Carell. We're talking with Dr. Carmen Tuchman and Dr. Carlenda Smith about health, what we can do for ourselves and the little ones in our life. Now, how about eating? Everyone really should consult their doctor for specific dietary needs. I'm questioning about any general guidelines that would apply to the widest swath of people. Dr. Tuchman, what's a good method of eating for adults?
I think it varies a lot, and there's not one size fits all prescription for this, but I would say that almost everyone could probably afford to eat a little bit more vegetables.
Okay.
That's like a good rule of thumb. And then I would also add that I ask patients a lot about what they're drinking. There's a lot of simple sugars in a lot of the beverages that people are consuming. And if there's one way that you can kind of easily improve your dietary habits, trying to switch to water and other drinks like that, or more nutritious beverages is a good starting point for most people.
What about coffee? Some people tend to drink 2 or 3 cups of coffee a day. Is that recommended?
Okay, I'm not going to tell anyone to stop drinking coffee because I wouldn't be able to function without it. But actually, the medical literature shows that moderate coffee consumption actually may have a positive effect on your health. Mm-hmm. I think when they're studying it, they're talking about black coffee, not with like sugar and cream and all the other things that we tend to add to it. But I'm all for a little bit of coffee.
Okay. Now, Dr. Smith, nutrition, proper eating is important for little ones. What are good guidelines for them?
It is. I tell parents to try to offer their children a variety of fruits and vegetables. Sometimes kids can become picky eaters. My toddler is definitely kind of in that stage. So I encourage parents to do a yes food, a maybe food, and a no food. A yes food is a food that you know they're going to eat. A maybe food is a food that, depending on the day of the week, they may or may not like it. And a no food is a food they probably won't like, but at least they've seen it. Mm-hmm. So I encourage parents to do a yes food, maybe food, and a no food, and offer a variety of fruits and vegetables and offer the rainbow, and not make feeding time into a huge battle, because then kids can feel that tension. So make eating fun and offer them a variety.
All right. Final question for both of you. Dr. Smith, you first. What type of attitude do you wish or want your patients and folks in general to have about their physical health?
I just want people to to remember that as physicians and pediatricians, we're partners in the health of your child. We partner together, and we're all on the same team, and that we are partners in your health.
All right. Dr. Tuchman?
There is no time like the present to try to be a little bit more healthy. And we are here and available. We want to collaborate with you and support you in that journey. And we just want to walk alongside you for that.
All right. Dr. Carmen Tuchman and Dr. Carlenda Smith, thank you both so much for being here. Thanks for the helpful tips.
Thank you.
All right. We're going to take a short break. When we come back, we'll be checking in with 2 mental health care professionals about how we can take good care of our mental health. Stay with us. This is Nashville.
Funding for This is Nashville comes from you, our listeners, and Music City Prep Clinic, Nashville-based provider for PrEP, and offering comprehensive sexual health services in an environment designed to be safe, professional, and shame-free. Learn more at musiccityprep.org.
I'm Khalil Colonna, and this is Nashville. Today, we're talking about preventative health and how we can take good and kind care of ourselves. Now we're going to turn our attention to mental health. Joining us is Beth Hale, a licensed clinical social worker at Centerstone, a nonprofit health system specializing in mental health and substance use disorder treatments, and Dr. Justin Gregory Briggs, a licensed marriage and family therapist. Beth, Justin, thank you both so much for being here. Welcome to This is Nashville.
Thank you for having us on.
Really appreciate it. Okay, so we're going to understand our mental health and the maintenance of our mental health. So get started. I want to talk about what mental health actually is. It's kind of one of those terms we hear a lot of, particularly on social media. We can talk about it in conversations. It's part of our lexicon these days with friends, but it kind of is difficult to get a handle on what actually is mental health, a lot more difficult than it is for our physical health. So according to the CDC, mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also determines how we handle stress, relate to others, and make what we want to be healthy choices, right?
Yeah.
So I want to ask you both, what does it look like to be in a good state of mental health? Beth?
Sure. From a child perspective, children who are healthy mentally are participating in activities. They're doing well in school. They are functioning, having, extracurricular activities, not using substances. So all of those things that would make them, feel good about what they're doing.
So if you had a teenager, an adolescent, they're in a good mental health space if their parents embarrass them. What we're saying. Because most of the teenagers, kind of embarrassed.
I would say that would be expected.
Okay.
Right?
Yeah.
So good mental health does not mean that you don't have negative emotional experiences.
Okay.
It generally means you have the skill set to know how to appropriately acquire meaning from those experiences. You know how to think in ways that are going to lead you to just happiness and well-being, despite the fact that the world's going to throw you some counterpunches there.
So on that point, it's normal and usual to have our mental health kind of fluctuate and change.
Oh,
essentially.
Absolutely.
Yeah, developmentally, if you look at the life cycle, your hormones and developmentally how you grow, things are going to change over time. You're going to have different needs. You're going to have different desires, and things are going to change for you as you age.
On that note, so Beth, answer this for me. What are some big things in life events or situations that can really impact our mental health?
Changes anytime there's a transition, changes in school, changes in who is in the family, a divorce, bullying is a big thing for children, adolescents, just adolescent hormones is a big change for them, and for them to try to figure out how to figure out their, world and how they're supposed to respond to that.
And for adults, it could be the changing of a job, as you mentioned, the divorce, maybe a potential death in the family, things of that nature.
Yeah, but even also physiologically, our bodies do change over time. We have hormonal drops as we age, and bring in an endocrinologist, and they can really get into what those look like. But yeah, I mean, there are lots of things that are going to impact mental health.
And I think one thing is what might impact you is not going to impact the next person in the same way. So everybody is so unique and individualized. You have to kind of look at what is going on and how are you or that person responding to that.
All right. Well, Justin, tell me this. What are some things that we can do daily to take good care of our mental health?
Yeah, well, in the previous segment, you started to really unlock the foundation, which is good sleep, diet, and exercise. If somebody's coming into me for psychotherapy and they're saying, I'm sleeping very poorly, maybe 3 to 5 hours a night, my diet consists of things that I box from a bag of chips, and I just don't have any exercise, I'm feeling depressed and anxious, I say yes. That's how you're supposed to feel. If you are exhausted, you're not getting the nutrient-dense foods that you need, and you're not engaged in those healthy routines. Now, once we have good sleep, diet, and exercise, we start talking about pro-social behaviors. The quality of your relationships is one of the strongest predictors of life satisfaction over the long run. And unfortunately, a lot of the behaviors that feed friendships, feed romantic relationships are learned behaviors. They don't come very naturally. For example, when we're engaging in conflict, most of us will naturally go into an attack, defend conflict style. I'm going to make a point. I'm going to attack you. Oh, you attack me? I'm going to counterattack you. That does not work in friendship. That doesn't work in professional relationships. Certainly doesn't work in romantic relationships. We have to unlearn that and learn how to do things like seek first to understand and then seek to be understood. Complain without blame whenever possible. And then know that our feelings are always important. They do not always tell us the truth. Depression, anxiety, for example, by definition, tell you that the world is worse than it actually is. It's excessive fear. It's excessive worry. It's sadness that doesn't fit the context in which you're experiencing it. If you're experiencing anguish after the death of a loved one, we call that grief. We call that bereavement. That is totally healthy. That's one of the faces of love in this world. But if you're waking up feeling hopeless, or this is the big one, worthless, there's not a human being that lacks value. We as mental health professionals, we believe that every single human being is inherently and pricelessly valuable. And once we start having depression, and that's a message that we're hearing, a good therapist is going to help you know, like, that can't be true. So what does this mean? Okay, maybe I'm depressed. So what do I need to do? How can I go about creating new positive emotional experiences for myself to help counteract what's coming much more naturally, which is a depressed mood?
So you're talking about self-care, which has been in our lexicon for about the last 8 years. Beth, tell me, knowing that it's not a one-size-fit-all type of solution or solve, let's say, what are some self-care practices that listeners can pick up that see if they work for them?
So there's some easy things, getting outside, interacting with others, making sure there's a good support system that includes friends, families, communities, activities. I would say a big one is unplugging from social media, and because so much of our news oftentimes is very negative, and having that constant news feed really has a huge impact on our depression or anxiety. Yoga, mindfulness activities, journaling, those are all things that really can help people kind of reset and get away from kind of the constant noise that they might be experiencing.
You know, my grandmother growing up, she used to always like to go fishing.
Oh, it's a great activity.
It was wonderful.
I would have gotten along with your grandma.
Yeah.
Yeah.
She's something else. Okay, so let me ask you this. Were either of you, this is live radio.
Yeah.
You know? Sometimes people come in and they're nervous and things. Were either of you nervous about coming onto the show?
I am.
You are?
Yeah, I'm a social worker, so this is not,
It's not your
naturally
jam.
what. Yeah.
So what did you do to handle your nerves about this appearance?
I did some deep breathing.
Okay.
I did some imagery, thinking about what I was going to say, and talked to a friend and practice. So, yeah, those are things that, coping skills that we would be working with people in therapy about.
Mm-hmm.
Yeah, some stress is good. It's distress that's bad. Some stress, some will call it eustress, which is the opposite of distress. That's the stress that's going to get you to prepare for a radio appearance. That's the stress that's going to get you to study for the exam or to really prepare for that new presentation at work. Or when we exercise, if you're not stressing your body to some degree, you're not exercising. Mm-hmm. So, yeah, I think, I felt a healthy amount of stress that made me want to take this seriously. So I brushed up on the things that we were going to talk about, physiologically soothe, take that deep breath, unclench my jaw, relax my muscles. You have a very nice, kind smile. Look around me. Everybody's cheering for each other here. Reminding myself of that really helps keep that stress in a manageable zone.
All right. If you're just tuning in, this is Nashville, and I'm your host, Carlenda. We're talking this hour about preventative health. We're focusing right now on mental health. My guests are Beth Hale and Dr. Justin Gregory Briggs. Okay, so I want to talk about people moving from the point to say, okay, my life is hard right now, but I've got this, to maybe this is too much for me and I really need help. How do we know when it's the right time to reach out for help? Justin?
Well, it really depends on the person, but I think sooner rather than later. And in a perfect world, people like Beth and I don't have jobs because everybody's able to get that social support from people who have, really good answers to a lot of these questions that people ask. But we don't live in a perfect world. We do not share common knowledge. So if you are having trouble with ways of thinking, identifying and managing emotions and behaving that are really decreasing your satisfaction with life, come in. Plumbers would say, call me when there's a drip, not after the pipe has burst.
Okay.
And, like in couple therapy, on average, couples come in 6 years after they should have gone to therapy to finally come into therapy. And imagine how much easier it would be to have gone 6 years prior. There's that much less that you're having to deal with. So sooner rather than later, therapy does not have to be a long-term commitment. In my practice, we track outcomes every session, every client, and on average, it takes just 2 to 5 sessions for clients to go from a distressed state to a maintenance or enhancement phase of treatment. And that's a really quick turnaround that you're measuring over weeks and a month or two that maybe you don't need to be coming in, every day for your psychoanalyst style where you're laying on the couch.
There's a lot of providers out there that can help. And if somebody finally says to themselves, hey, I'm going to seek help, I have a drip coming or a little bit of a flow.
Yeah.
I need to find a plumber. There's a lot of therapists out there. Beth, how can someone find the right plumber to help them clean their mental pipes, so to speak?
Sure. It is overwhelming. If you've not reached out for services before, there's a lot of information out there. But Tennessee has great resources and for mental health services. One of the suggestions I like to have people look at is Tennessee's Department of Mental Health and Substance Abuse Services website. It has a ton of information about programs, services, providers across the state, and it's a really good place to get started if you're looking for trying to find help.
Now, you work with providers in school-based programs. Centerstone has over 150 school-based therapists that provide family and individual therapy. Tell me a little bit about those programs that you all offer to students and their families.
Sure. We have both outpatient clinics and then our school-based therapy program. Our school-based therapy is for those individuals that would like to enroll their child in school-based therapy, and we actually do the therapy at the school setting. So we're meeting with the families at school. We are meeting with the child and the school grounds. One of the advantages is that's often where the child starts having trouble, that it's first identified that something might be going on. So we can work very closely with the teacher and the parent to try to figure out what's going on and be able to do the therapy right there at the school.
Okay. Now, Justin, let me ask you this. You mentioned that most couples come in 6 years, a little bit too late. So are they in moments of crisis when they come to see you?
Yes, commonly people will be calling in moments of crisis. Not exclusively, though. We do have a lot of people who are coming in for a tweak rather than a total overhaul.
Okay.
And those are really good times to go into therapy. Don't wait. You could ask friends. There's much less stigma now than there was when I got into the field around mental health. Ask your friends, who are they seeing? Who's working with them? Go to the therapist's website. Ideally, they have some sort of outcome measures that they're using that you could see, these patients tend to get better on this type of time frame. That's encouraging to me. Mm-hmm. Client hopefulness and expectancy that things can get better is one of the strongest predictors of treatment outcome. And most of the time when people are calling me or my practice or my colleagues at the Briggs Institute, they're coming in with things that we know therapy can help with if the client is really willing to work hard. Unlike some like medical or surgery interventions, therapy really requires an active role on the part of the client or the patient, much like exercise. You could be with the best physical trainer in the world, but if you're not willing to put in those workouts, you're not going to meet your fitness goals. Mm-hmm. Very similar with therapy. It's not something done to you. It's something you have to be an active agent in.
Okay, now couples therapy, the key word is couples, two people.
Absolutely.
What if one person is gung-ho and wants to go, and the other one skeptical, hesitant, or even resistant?
Yeah, this happens a lot. I get these phone calls, and my wife or my husband really doesn't want to come, and I'll have them give me a call. And I will let them know that the research shows that your partner's perception of you is one of the strongest predictors of relationship satisfaction. So even if you don't think that your relationship is one in need of therapy, the fact that your partner does should be really important. And I'll say something like this. Do you want your relationship to be happy? Yes. Does your partner think your relationship is happy? No. Should that matter to you? Mm-hmm. At the very least, come on and let's talk about it. Let's find out what your partner's reasons are for maybe having some concerns, and let's see if we can iron those out.
All right. I want to talk about the number 988 emergency help. Beth, can you tell us about that? It's the Tennessee Suicide and Crisis Hotline. What is it and what's it for?
988 Suicide and Crisis Lifeline is operated 24/7, 365 days a year. It is phone, text, and call capabilities. And a trained professional would be able to help somebody that's in emotional distress or having suicidal thoughts. And they can call or text. There's also a website, 988lifeline.org.
All right. Now, this final thought from both of you. We live in 2024. Social media, in the news, like we started off, a lot of people are talking about mental health. It's in the zeitgeist,
yes,
which
wonderful.
Also means we have Sunday morning football season. There's a lot of armchair quarterbacks. We have a lot of armchair therapists.
That is true.
So you're both trained professionals. With that in mind, what do you want people to take away with them when it comes to care of their mental health?
Well, I would say that working with a trained mental health professional, you could learn things that are uncommon knowledge that become a part of your daily routine. And you might be able to find that your life is satisfying at a level you didn't even know was possible because you now know ways of thinking, ways of identifying and managing and creating emotion, and ways of behaving that are supporting you in your life goals. And you might find that life is a lot more satisfying, never stress-free, never even tragedy-free, never even trauma-free. All of us have loved ones who pass away or experience those things, but knowing how to manage those, it's almost like wearing superhuman armor. You might not be unscathed, but you're able to survive those little battles. And the best case scenario in life is really your biggest problems aren't your fault because you're just living in this imperfect world, but you're managing that so well. So I want people to have hope that things can be really good, especially when you are taking care of your side of things, which is your thinking, your emotions, and your behavior.
Beth?
I would say very much the same thing. It's not a lifelong, forever process to be in therapy, but it really can change the direction of your life because you're learning coping skills and you're learning things about yourself or how you interact with others that can just enrich your life.
Beth Hale is a licensed clinical social worker who works at Centerstone. You can learn more about their programs, including financial support for services, on their website. You can also find more information about state programs through the Tennessee Department of Mental Health and Substance Abuse Services. We will have those links on the web post for this episode at thisisnashville.org. Dr. Justin Gregory Briggs is a licensed marriage and family therapist. Thank you both so much for being here today.
Thanks for having us.
Thank you.
We're going to take one more break. When we come back, we're talking about sex. That's right. We're going to talk about preventative sexual health. Stay with us. We'll be right back. I'm Carell Colonna, and this is Nashville. Welcome back. Welcome back. Today, we are talking with healthcare providers about preventative health measures that we can all take and use, what we need to keep in mind to keep ourselves healthy and well. Right now, we're going to turn our attention to sexual health. Joining us to continue the conversation is Dr. Kasim Borghi, who is the incoming director of Nashville Cares, a sexual health clinic that focuses on HIV prevention and treatment. Longtime listeners will know we've talked about that wonderful organization quite a bit. Also staying with us is Dr. Justin Gregory Briggs, a licensed marriage and family therapist. Dr. Briggs, Dr. Borghi, thank you so much for being here.
Thank you for having us.
Thank you for having us.
All right, we know sex is uncomfortable for some to talk about, and we're here to talk about it so we can keep ourselves safe and make the most of our sex lives in a straightforward, and I promise listeners, a very, very PG way. So let's talk about sex as a overall part of our health. A lot of people, as I mentioned, are uncomfortable talking about it, but you both work with patients regularly, have conversations about their sex lives and their behaviors. Dr. Borghi, what do you want patients to know when it comes to talking to their provider, either a doctor or a therapist, about sex or any concerns they may have related to sex?
Yeah, I would say that sexual health is a crucial part of overall health. And I would encourage all patients to be very open with their providers about their sexual practices, their sexual orientation, as well as any kind of concerns they might have regarding their sexual performance. Providers are trained to get good sexual history and are trained to listen as well as to address all of those concerns. But it also counts on the patients to be very open and open about any concerns that they might have.
How does sexual health fit into overall health? Are there things that can pop up in our sexual lives, in our lives sexually, that are indicators of other bigger problems with health, Doc?
Yeah, well, certainly. I mean, I see the world through a systemic lens, and that means I see the interrelatedness from things like our biology and our psychology and emotions and our social systems, our work, right? So sex is just one of those contexts where problems can show up. And, you know, sex is the strongest drive we have as human beings after food and shelter. So even if you're not having sex, it's usually something that's part of you. So I encourage people, come and talk to us. You're going to blush before I do. I've heard every version of stories over the last almost 20 years. Mm-hmm. And you're in all likelihood going to have a provider who has a non-anxious presence. And that's really disarming for folks. And one of the things I commonly hear in therapy with individuals and couples when they talk about their sex lives is they say, that was a lot easier than I thought it was going to be. So if you have concerns, you might find that it's a lot easier than you thought it was going to be to talk about sex with a professional.
Have either of you found people are hesitant because there's a fear of a stigma or judgment?
I noticed that a lot of time people are not as open talking about their sexual health as much as they are talking about other parts of their health. I think the other part that we have to also address that sometimes providers don't make it as easy for patients to open up about sexual health. So I would encourage all providers to ask very non-stigmatizing questions. And there are systemic questions like the CDC has guidelines on how to ask those sexual health questions in order to encourage the patients to be more open about sharing something that's incredibly intimate. And for most of the time, they have a lot of fear of being stigmatized or stigmatized against for sharing that part of their personal story.
One of the largest reasons to be up on our sexual health is sexually transmitted diseases, infections, or STIs. Now, Dr. Borgi, for anyone who maybe didn't have sex ed or missed the class for whatever reasons, what are some of the best ways they can protect themselves from STIs? Not only protect themselves, but educate themselves about them.
Yeah, absolutely. So I would say the most common STIs other than HIV are syphilis, chlamydia, gonorrhea, HPV, and hepatitis B. So number one protection would be using a barrier protection. So for example, condoms. But also we have recent data and very exciting data to tell us that there are something called chemoprophylaxis. So taking a very common and old antibiotic like doxycycline, 2 tablets or 2 capsules within 24 to 72 hours after sexual encounter has been shown to be incredibly effective in reducing the risk of syphilis, chlamydia, and gonorrhea. For hepatitis B, there is a very effective vaccine in order to prevent transmission of hepatitis B. And for HPV, similarly, there are vaccines that are incredibly effective. And recently, the time frame to get those vaccines have been increased to up to age 45. So I would say the cornerstone of protecting yourself from STIs is to get tested, to encourage your partners to get tested, and also to discuss those with your provider so that you can seek some kind of preventive measures that can be extremely effective when added on top of barrier protection to reduce the risk of STIs.
Now, in Tennessee, which population is at the greatest risk with STIs?
So talking about STIs as well as HIV, we have to notice that in the Southeast in general, this is where we're seeing the largest number of new HIV infection as well as an emergence of syphilis. Within this particular region, there are certain populations that are at increased risk. So we're seeing, for example, a higher number of new HIV infections among younger patients. The other part is among racial minorities. So, for example, the risk of HIV in the Southeast is significantly higher for young Black men compared to other racial groups. So, knowing these high risks is also should be a driver for policies in order to expand access to healthcare and access to HIV and STI testing to address this epidemic.
Given that we need to expand our access to it, how easy is it currently right now for someone to get tested for HIV?
So right now, there's a lot of different organizations. Nashville Cares is one of them that provides very confidential testing for HIV. So HIV testing has come a long way. So you could get tested for HIV at your home with oral screenings that are very sensitive in detecting HIV. There are also tests that could be done at the office-based that you could get the results as quickly as 20 minutes. And in addition to that, the old blood testing for HIV. So those tests can detect HIV as early as 2 to 4 weeks after exposure to HIV.
If you're just tuning in, this is Nashville, and I'm your host, Carell Colonna. We're talking this hour about preventative health. Right now, we're focused on sexual health. My guests are Dr. Katherine Borgi and Dr. Justin Gregory Briggs. Now, Justin, you work with individuals and people in couples therapy. Mm-hmm. How often does sex come up in those sessions?
It comes up in 100% of my assessment and screening with my patients. It's one of the parts of what we call a biopsychosocial assessment. I ask about sexual functioning, sexual history, and it's something that we cover. And I would just add, in terms of preventative, sexual health, talk to your partner. Find out, when was the last time you got tested? Can I see that paperwork? Mm-hmm. And if that's an awkward conversation, maybe ask yourself, if I can't have that conversation, am I ready to have sex with this person?
Yeah.
That's a really important piece of it. And I recognize it could feel very awkward to have that for a lot of people. So come talk to a therapist, develop some strategies for having that conversation. It's usually, as awkward as that could be, it's usually better than finding out the hard way that you now have an STI.
Yeah, that's what I was thinking. I'm like, the more awkward conversation is calling someone up.
Yes.
And telling them that bad news.
I have to tell you something.
Yeah.
You may need to get tested, or just finding out I am now somebody who needs to obtain some health care for an STI. Mm-hmm. That is I want my patients thinking not just short term, but also medium and long term. And a lot of times we make decisions based on short-term comfort that come at the expense of our long-term comfort. For example, I don't really want to have this awkward conversation with this potential partner and ask about their STD status. That seems too personal. You should probably have that, though.
You're about to get real personal with
You're
them.
about to get real personal,
Yeah.
right? Because you're not just having sex with that person. You're getting exposed to previous partners that person has also had.
Now, when it comes to the therapy that you offer, if someone or a couple, they're having an issue related to sex, do they need to seek out a specific sex therapist?
Well, there is not a separate license for sex therapy in the state of Tennessee. So most couples therapists are going to be trained in having these conversations. Find a therapist who advertises it as maybe an area of special clinical interest. There is a set of knowledge that you acquire when you develop the skill set of a sex therapist that maybe the average clinician does not have, but call somebody up, ask them, I want to talk about issues related to my sexual health and sexual performance with my partner. Can you help me with that? And therapists will tell you that we want to be helpful to people and we don't want to waste anybody's time. And so you're going to hear an answer of, maybe it might be better if you go see this person over here. I know that they do that work really well. Or absolutely, come on in. I'm talking about this with clients every day.
Now, due to, again, we're in 2024, due to the internet and social media, people are a lot more open in talking about sex, even though maybe in the personal settings, as we've just discussed, they're a little bit more shy and coy about it. But let me ask you, Dr. Borgi, seeing that sex is kind of everywhere these days, and it has been for a while, how do you hope people approach thinking about sex?
Yes, I hope that everyone realizes that sex is a very important part of life, and also sexual health is a very crucial part of overall health. Neglecting sexual health is going to have a ripple effect on other aspects of your life, whether emotional intimacy, whether increasing your risk of STI acquisition and therefore problems with partners, but also on your mental health in general. So addressing the sexual health as part of a crucial component of overall health is very important. But also normalizing discussions about sex and making those a regular part of discussions that you have with your own partner and also with your own healthcare provider makes it a lot safer to get tested for STIs as well as to seek some prevention measures for STIs and HIV.
What are some of the things folks can do to improve their sex life?
Yeah, so for example, focusing on, if we're going to think about decreasing the risk of STI acquisition and HIV prevention. So we live right now in a very exciting time where there are extremely effective medications that can ultimately reduce your risk of HIV acquisition by more than 90%. So this allows you to take the power of protecting your own health and decreasing your own risk of getting HIV. So this is what we call HIV pre-exposure prophylaxis. There are currently 3 FDA-approved medications, 2 of them orally, 1 of them is given intramuscular. But also there are a lot of new medications that are coming in the horizon that could be given as infrequently as twice a year. So those kinds of interventions, they allow you as a patient to take the power of protecting your own health but it also involves you discussing this with your healthcare provider and seeking those treatments.
Justin.
Yeah, I think it's really important to have these conversations with your partner. The sex you want on a Tuesday isn't necessarily the sex you want on a Thursday. I developed something called the Sex Test by Sex Life Science. I also have a podcast called Sex Life Science, and we talk about how it is variable, for different people on different days of the week. Again, what you want changes day to day. Talk to your partner. If you don't know what you like, that's what the sex test is designed for. It gives you an inventory of things that you like and the frequency in which you like those. You could share that with your partner. It's also important. I don't know what your results are, but you know what your results are. And really just getting that understanding of what are my interests? What are my likes? What are my dislikes? What are my partner's likes? What are our interests and likes today as opposed to yesterday or 2 days from now? Have the conversation.
For people who are in maybe very long-term committed relationships or people who might be slightly casual, is scheduling sex a good idea?
It's the only way a lot of couples are going to have sex. And I really encourage people to do away with this idea of spontaneous sex. there's been no time in human history where people have been sitting next to each other and then all of a sudden they're saying, our genitals are entwined. Okay, that has never happened. Somebody's thinking about it at least a beat before it happens. What something like scheduling sex does is you're saying, this is important to me. This is important to my relationship. This is important to us. Hey, what does our schedule look like this week? And it's like planning a vacation.
But that's not how it goes in the movies. And some folks would say that scheduling sex takes away from the excitement of the spontaneity of sex.
And for them, that might be true. I would encourage a reframe.
Okay.
It's just like a vacation. If I said you've won a vacation to your favorite destination and it's coming up next month, my guess is you're going to be looking forward to that, aren't you?
Yes. Oh, yes.
It's something that you're anticipating. You're daydreaming about it. And sex could be the same thing. It could be that wonderful daydream that brings you a bright spot in a day.
Now, speaking of someone who just came back from vacation, it was a wonderful, wonderful dream. All right, I want to thank my guests. I want to thank Dr. Kasim Borji and Dr. Justin Briggs. Thank you both so much for being here and being a part of this conversation. I really appreciate it.
Thank you for having us.
And This Is Nashville is going to take on a late night feel. So on Monday, June 20th, 2024, at Vanderbilt University Blair School of Music, you can join us for a night filled with laughter, witty banter, and we're going to have some unexpected moments, I promise. Remember, pre-sale for tickets starts Monday, May 20th. Stay tuned for guest announcements. They'll be coming your way very soon. Thanks to you all for tuning in to this hour of This Is Nashville. We're a production of Nashville Public Radio. Today's episode was produced by Katherine Ceicys. It was directed by Tasha A.F. Lemley. Our technical director and board operators, Liv Lombardi. The masterminds behind our theme music are Larange and Namir Blade. Listen back at thisisnashville.org or wherever you get good podcasts. And the conversation doesn't end here. Tweet us at This Is Nashville. Find us on Instagram and tell us what you want from our show by filling out our quick survey online. This is Nashville. I'm Khalil Ekaluna. We'll see you on Monday, everybody, and be good to each other.